Hey, welcome. Today we're talking about, can you have a normal delivery with fibroids? I'm Dr. Perkins, a board certified OBGYN, and I'm excited to talk about both of these topics. And so come on in, let's talk about it. We'll talk about what are fibroids and how prevalent are they? We're going to dive into how fibroids may impact your possible delivery options, and we'll review the risks associated with fibroids in pregnancy. And guess what? If you hang on until the end of the video, I have a free gift for you today. All right? So let's tune in, sit down, and have a conversation. All right, so what are fibroids? Well, fibroids are growths that are often, more than likely, non-cancerous that grow inside of your uterus. They are like little balls that can be as small as a grape or as large as a cantaloupe. And so they grow inside of your uterus and they grow from uterine tissue. And what we do know is that they love hormones. They love estrogens. They love progesterones. And the more that you have, the more that they grow. And this is kind of like the key reason why hormonal balancing is so important. Let's put that aside for a second and let's talk about how these fibroids may impact your mode of delivery. At this time, you're probably pregnant. You probably also know that pregnancies last 40 weeks, or in our medical world, that's really about 10 months of time. We know that your body may change drastically during that time frame with or without fibroids. We know that you can have a successful vaginal delivery if you have fibroids. We also know that fibroids can increase the likelihood of you needing a cesarean section. Now let's break this all apart. Fibroids can be in any of the 3 layers of your uterus. They can be submucosal, meaning they're on that inner part of the uterus. They can be in the muscular layer, which means that they are intramural by name, or they can be on top of your uterus, like almost on the outer skin. And in that area is called a subserosal fibroid. And so depending on where they are, and depending on how large they are, this may impact whether or not you can have a normal delivery. And so for the duration of this video, if I mention normal delivery, I'm really referring to a vaginal delivery. Which fibroids are more than likely to be problematic? Well, firstly, any fibroids that are on the inside part of your uterus. And so those are the submucosal fibroids. They're in the endometrium. They're on the inside part of the uterus. And they cause more problems in the earlier part of pregnancy, like having bleeding. They can cause you to have miscarriages. They show up and show face on the earlier side. But one thing we do know is that on the back end, meaning the end of pregnancy, they may also cause you to have a placental abruption, which means that your placenta separates from the wall or the lining of the inner part of your uterus where it shouldn't separate, and it does so before your baby is delivered. And with this, it can be really extremely dangerous for your baby, your pregnancy, because babies can lose their life when they're not getting the blood flow they should because this premature separation happened. And so fibroids can cause that, especially if they're located on the inner parts of your uterus as well. And unfortunately, during pregnancy, if this is the case, we're not able to remove these fibroids to help to secure the pregnancy, not while you're pregnant. We can absolutely, and it's recommended to remove them before pregnancy. Location is one, so we know these submucosal fibroids are a little bit of a problem. The next thing is that the size of the fibroids, regardless of the layer of your uterus where it is found, may cause you to be at increased risk of needing a C-section. So for instance, I had a patient recently who had a uterus that is essentially normal, except that she has this one fibroid that the ultrasonographer or the radiologist mentioned. And they mentioned that the fibroid is in the back of the uterus, and they mentioned that it's about 6 centimeters. And so we're like, okay, we continue on with pregnancy. The fibroid is not obstructive. Obstructive meaning that it's not blocking the exit way from the pelvis. We got to be full term and had an induction, and this is because we're past the due date and baby still hasn't come, and so we needed an induction. Went through the induction process. About 26 hours later, we're fully dilated. This is wonderful. And then she began to push. And hour 1, she's pushing, and she's giving everything she's got. Hour 2, she's pushing, everything she's got. Hour 3, we are pushing and pushing every 2 to 3 minutes. Baby's still high in the pelvis. Hour 4, she's still in this. Like, I really, truly want to do this. And she's still pushing. Hour 5, I'm like, this is not looking good. We may really need to have a C-section. But she really wanted to power through. And she's just like, I've got more juice in me. I want to push. Hour 6, she was still pushing. Hour 7, still pushing. And baby would not descend and would not move out of the pelvis, would not move into the vaginal space. It was just not going to happen. And we really had a conversation because she was motivated and she really wanted to do this naturally and vaginally. But this was clearly not the right time or the right situation for her to do that, because baby was just not coming down. And so we had a C-section, and this fibroid that we thought was about 6 centimeters, which would be probably about that much in size, was more like 10 centimeters. This fibroid was massive. When I took out her uterus, not a hysterectomy, but for the baby to be delivered and to repair her, and I felt that fibroid was massive. And there was no way that baby could pass by this fibroid in order to be passed through the pelvis and through the vagina and have a vaginal delivery. This is sometimes the risk with fibroids. They grow in pregnancy because they love hormones, and pregnancy states are filled with hormones, and they can grow almost overnight from whatever size they are to be much larger. And so ultrasounds are important to monitor the growth over time. And if you can get one in the last month of pregnancy, that's great, because that would give you a more accurate picture of the current state of your fibroids. It's also important that we understand that where they're located can impact the likelihood of having a natural delivery. It is completely okay to attempt, and it's completely okay that if you have fibroids, that you commit to having a vaginal delivery. But know that your body will speak louder, and it will tell you what will work for you in that current state. And so sometimes it means that you need a C-section, but a majority of the time it means that you're able to have a vaginal delivery. You just be patient and you trust your body. Talk to your doctors. If you know you have these fibroids and you're concerned about whether or not you can have a vaginal delivery, your team needs to be your team. They need to be working in your favor. They need to work with you. And so you have to express your desires, express your needs, and express what you're going through so that you can have a good, informed conversation and create a plan that will work for you. But know that it's absolutely possible. And so the simple answer here is yes, you can have a vaginal delivery and a vaginal birth with fibroids, but it's all dependent on where they are, how many, and whether or not they're obstructing the pathway for your baby to exit your pelvis. And so I hope this makes sense. Thank you so much for hanging out with me today. I have a free gift for you. I'm so excited to share with you a free copy of my ebook, Hormones Don't Lie, so that you can learn more about balancing your hormones and becoming more hormonally stable so that you will decrease the likelihood of your fibroids growing and other things that can happen when you're in a hormonally imbalanced state. To do so, click that link in the description and I'll send that right over to you. Thank you so much for joining us today, and leave a comment below. Let me know, what did you think about this information? And if you have questions, drop them there as well. I'll be happy to answer. Thanks again for joining us. I'm Dr. Perkins. Take care.